A common healthcare topic that I encounter socially as well as here in the clinic is about thyroid. And I think a lot of people get very frustrated when they are trying to discuss thyroid with healthcare practitioners because the conversation is very short and limited. And I view the thyroid from a very different perspective. I think we need to look not just at some of the screening testing, but to actually test the level of the active thyroid hormones, T3 and T4. We can also evaluate the ability to convert T4 to T3 and look at some of the nutrients that are important, such as iodine and selenium. Or we can look at elements that are toxic to the thyroid, such as cadmium and bromine. So we have options beyond a simple screening test for thyroid. It's also necessary, I think, to talk about nutrition. The thyroid hormones need to be manufactured from particular elements, that's iodine and bromine. And a lot of people are deficient in their diets, and so we want to have a discussion about how to include that in your foods and how to get that variety of foods and nutrients that helps to make thyroid hormone. We also want to consider environmental factors. There is stress. There's also female hormones and male hormone balance, as well as toxic elements. And I think that we really need to consider that as we have a longer conversation about thyroid. I find it very dismaying that so many people eventually would come and visit us and say that they've been tested X number of times or they've brought it up and they really feel that their concerns are dismissed when they try to talk thyroid to a healthcare practitioner. I think it's important that when a patient has a hunch, when they have felt strongly about something and they share that with the practitioner, we should listen. At the very least, they're helping us do our job by talking, and we need to take the time to talk about the whole picture. So I would like to honor that when my patients have a concern and take the time to listen. And talking about thyroid is a situation where I think we do that very well.